Okay, so I would like to welcome Doris Baxter and Marcia Pallmer to talk to us about leaving the hospital for sick children and preparing to come here to us, UHN. What are we doing?
We're just preparing for you. Yeah. It's us preparing, to see you guys leave. And I was looking at the young men, the young ladies, and I wanted to cry because I've had them since they were babies. And it's hard. I don't let go of my children very easily, my own or others. And it's hard, so you guys better take good care of them. I think we've taught you well, both the parents and the children. And we hope that you can take that with you. There's some things that we'd like to stress. And for the young people that will be coming to UHN, make sure you all know what your baseline hemoglobin is. You need to know your CBC, the values. You can ask us and we can discuss that with you. Because that's one of the first questions that we hear that you're asked when you enter the hospital. Okay. What is your baseline hemoglobin? So you all have to know that before you leave HSC, okay? You need to know, are you SS, are you SC, are you S-style? You need to know that, because you need to bring that information with you. You need to know all the vaccines that are necessary for you. You need to know the ones you've had and the last time you had that. Carry that information with you. You need to know the pain medications that you have been taking, what works for you and what doesn't work for you. Okay. You need to know the hospitalizations that you've had. Have you ever had chest crisis? Have you ever had an ICU admission? Have you ever had exchange transfusion? Ask us about that and why these things happen. You need to know that. You need to know all the tests that we've been scheduling for you. Parents, we've been telling you this is what you do, and we've been telling the children. You need to know why you get your yearly test, what they are, why you need them. Okay, those things you need to know. What else do we need to know, Marcia?
They need to know all those things, but also when we do the transition passport with you guys, it's not for it to be sitting in your purses or in your wallets. The information on it is for you to use. So when you get over to TGH, you pretend like you've never heard about your baseline hemoglobin or anything like that. You have that information. Because we do give you that information when we do your passports with you. So you have the information that Doris was just saying you need to know. You have it. We don't expect you to know it offhand in your head, but we've given you this information. So when we give you your passport, we expect when you get over to the Toronto General, you have your passport with you. So when Dr. Ward says to you what's your baseline, he doesn't expect you to know it off your head. You can open it, look in it, and say, okay, my baseline is so and so. So we expect you to use this information that we have given you. So by preparing you, we do certain things with you. We tell you you're going to have your appointment at TGH when you get to age 18. We also tell you that at age 18, do not try to ring it and come over to sick kids when you're ill and try to get through the emergency, because then they call us and they say, well, your patient is downstairs and they're 18 and we can't do this. Don't try to do that, because you're now 18, you have to go to Toronto General. Okay, so you can try, but you're not going to be successful because they're looking at your age on the screen and they see that you're now 18, you can't ring it. You might not look 18, but on the screen they're saying you're 18, so they know you're 18. So you have to go to Toronto General. It's not that far away, it's across the street, and there are healthcare providers, like Dr. Kirby said, that are here that will take care of you. Yes, a question here?
Yes, I mean, I know you want to do the questions at the end, but
Yes.
to me this sounds, I don't know how to say it, but I know the patients need to be well educated and well aware of their condition, especially their own case. But when you transition that patient, don't you have to send the file to the physician?
Yes, we do. So a
So I mean,
transfer.
why are we trying to rely on the patient knowing all their own
Okay.
medical records or history? It's the responsibility on the communication between the hospitals.
Mhm.
If my family doctor sends me to a specialist, I'm sure he would write in the note, this is what this case and this is what we are suspecting. That way he could put the particular information or pertinent information included in that.
Or if I'm pregnant and my family doctor sends me from his office to Mount Sinai, I know the reason why I'm going to Mount Sinai because I'm pregnant. That's why I'm seeing you. So upfront, I need to know that why I'm coming to you is because I'm pregnant, and these are the things you're going to be doing for me. So the same thing, you're going to Toronto General. You're going to Toronto General to the blood disorder clinic, and these are the things that you need to know. We're not saying that you're going to know all your values. Like I said, you have the passport, and the values of your last test and what it was, whether it was normal or not, is there. But we expect you to know that certain things we expect you to know. Your baseline, for instance, you should know.
Then this is something that should be done routinely at 6 years before
Yes.
the patient reaches that age. So he's always aware of what's
So
going on.
now we've
Not wait till just before they transition.
Okay.
Riyadh, I'll answer to that. Knowledge is power, and we're empowering our patients, and they have to participate in their care. They are not children anymore, they are growing up. And as a healthcare provider, it helps when the person who is sitting in front of me can share the information, then we can dialogue. So we're not expecting them to know everything, but we expect them to know certain stuff.
Start early on, at the age of 12 and 13, maybe, at the most 14 or 16.
no, but that's been put in
Not at the
place.
age of 18 or 19 when they're transitioning.
No, but that's been put in place now at 6 kids where we're starting at an earlier age. So we're starting from age 12 to let them know that when you get to age 18, you're going to be going to an adult facility. These are the things that will happen in an adult facility. We're saying to them, now you know. What I do now is that all the patients who are at 12 and 13, I give them a quiz about their sickle cell and what they don't know, then I try to educate them about their sickle cell. So we start at an early age now. Yeah.
Partnership. What you need to know, parents, what you need to know is you are not the ones that the doctors or the NPs will be talking to.
Toronto General.
And that is going to be difficult, okay? So you have to prepare yourself for that, okay?